Being able to talk is so basic, and not being able to talk. And that after a while that came back, but in the very beginning I couldn't actually talk at all, and it's a very frightening place to be.
After stroke, about approximately a third of people have some kind of language problems. These are called aphasia, and aphasia is very variable. It can be quite mild, where people just maybe have difficulty thinking of a word, like the tip of the tongue experiences that we all have. And people with more severe aphasia may actually have difficulty getting anything out verbally at all. They may have also some problems understanding what other people say to them, and also sometimes with reading and writing. So aphasia is actually quite debilitating. People may have another condition called dysarthria, which is really a speech problem. Their speech may sound slurred, it may be slower than before, their tongue may not work quite as efficiently as before, and so you get a change in the articulation. But along with that you can have changes to the voice, to the resonance of the voice. So aphasia and dysarthria are two of the most common. And also often running alongside certain kinds of aphasia you can have a verbal dyspraxia, which is again a motor planning problem where people go to say something but the right sound doesn't come up because they haven't got the movements quite right. They haven't been able to plan those movements. So those three are the main ones that affect speech and language. A lot of the therapies that are offered are around helping people to find words again. One, for example, is called circumlocution, where somebody may try to think of a word. Could be perhaps quite a simple word like shopping centre, and if they're having difficulty, they'll often be encouraged to talk around that. I'd like to go to that place where there are lots of different shops where you can park outside. What's it called? Sometimes people can find words if they cue themselves. They might think about just the first sound of that word, or they might imagine in their head what the first letter of it might be, and just thinking in those terms could help them. There may also be therapy that's directed more to the conversation partner. So rather than focus entirely on the person with aphasia, therapists may well work with family members and friends to try to help them simplify things or make conversations slower, accessible, patient, to help them cue the person. Groups allow people to come together and to meet other people in the same boat, and they're often very helpful in allowing people to practice their conversation in a safe environment, because the best practice for talking is talking.
We had the school of relatives into counting to 10 at first. If they asked us something, count to 10, and let a kick start. And for the first 6 months, she had a signature word she'd use, and the first one was Friday. Every sentence started with Friday. And then over a period of 6 months, the word would change.
One of the things that will help me, we start singing. One of my problem had a stroke. I got a problem with the temple on the side, and the nerve, all the whole face, and start singing. We can't some exercise all about the mouth, and that's working was much better. That we've done that 4 years ago after I've had my stroke, and I can feel my face is much better all the time now.
I had to learn to talk again, and 10 years, but I'm much better.
Wendy won't let me take this off either. But it's amazing how many people ask you, what's that A word? And we can relate it to that and relate it back to stroke. And the figures are more than a third, or at least a third of people that have a stroke have aphasia of some sort.
Everybody is really different, and so everybody's journey is different. But we know that people with aphasia continue to improve for years and years and years after their stroke. And we know that even if formal therapy stops, it's really important that people continue to just re-engage with interaction, conversation, and have the confidence to go out and get really as many interaction opportunities, conversational opportunities as possible.